It has been 6 years now since I'd first purchased and began using my PlanMecca ProMax cone beam imaging system. When the technology was first introduced in dentistry, I realized its importance specifically in the field of implant dentistry. I'd been placing and restoring dental implants in my practice and held the firm belief that the third dimension was a necessary component for diagnosis and treatment planning in implant dentistry. At the time I purchased the technology, there were several imaging units in the marketplace for me to choose from. I chose the PlanMecca ProMax 3D for several reasons. PlanMecca is a strong company with a reputation for excellent customer service and an industry-leading line of advanced dental technology. The unit itself allowed for both two-dimensional and three-dimensional imaging. It allowed for variation in the size of volumes from large to small, and variation in the amount of radiation used per image. These features place the PlanMecca ProMax 3D at the top of my list for purchasing. The sales process and installation process were simple and seamless. Advanced technology requires several levels of training, which was provided by PlanMecca for myself and my staff on several occasions. In addition, I visited their training facility near Chicago for advanced software training. Once I began using the 3D on a consistent basis in my practice, I realized that the technology had important applications across all disciplines of dentistry. Its use literally changed the way that I diagnose and treatment plan on a daily basis. Beyond implants, I've changed the way that I approach endodontic problems. I've changed the way that I treatment plan third molar extractions and their referrals, and also the manner in which I treatment plan pathology of all types. I'm often asked by my colleagues whether my investment in the PlanMecca ProMax 3D was worth the cost. My answer is an unqualified yes, from the perspective of elevating the level of care I afford my patients, through enhanced diagnosis and treatment planning, to being a true financial return on my investment. I have absolutely no hesitation in recommending both this technology as well as PlanMecca to all who ask. Initially, a concern that I had regarded radiation dosage. However, it took very little time for me to become knowledgeable of the facts. A cone beam image actually uses an equivalent amount of radiation as a full-mouth series of x-rays do. I have full confidence relaying this information to my patients, who are all naturally concerned about radiation dosage from medical and dental devices. Patients are awed by this technology. Many don't even believe that such imaging was even available. It allows my patients to be fully educated regarding the procedures they'll be undergoing, and more importantly, they are more comfortable and confident regarding outcomes. Since I began using 3D technology in my practice, I've changed the way I approach marketing and patient outreach. My marketing efforts help both prospective and current patients see that what I offer them is above and beyond what most practices do in terms of skills, technology, and in education. I'm what you would call an early adopter of technology. I assess the technology, I weigh its value in patient care to its cost. With respect to many digital technologies, in many instances, the cost is high, but I realized that its applications were enormous. Digitization in dentistry is inevitable. Its incorporation and mastery I viewed as being a necessity. I first invested in CAD/CAM and used it successfully for a decade prior to integrating cone beam imaging. I began using chairside CAD/CAM in 1996. Cone beam was not available at that time. As soon as cone beam became commercially available and affordable, I adopted and integrated cone beam technology, and I've only benefited since that time. The learning curve for advanced technologies is always higher than for other techniques and devices in dentistry. For me, the learning curve for CAD/CAM was about 2 to 3 months. For cone beam was a few weeks. I found that this differs for individual dentists. Comfort with computer input and a mouse facilitates the learning curve, and the more that dentists are comfortable with these and with computers, the easier the learning curve becomes. Because in essence, all that has to be learned is another computer program. As time passes, the programs have become more and more intuitive, and they become simpler to learn. In addition, more and more doctors who are purchasing and using advanced technologies today have greater degrees of comfort with computers.